Magandang umaga po mga kaibigan sa ating coffee chat. Kasama nating magkakape virtually si Dr. Tony Leachon, isang public health advocate at isang matalik na kaibigan at makikibalita tayo. Ano yung kanyang pananaw sa mga nagaganap ngayon sa larangan ng kalusugan? Especially yesterday, we hit a record high of 17,231 new cases, which is the biggest since COVID-19 was felt in the Philippines. And there was also this report that 5,595 recovered, and sad to say, there were 317 fatalities. The tests conducted by the government reached 64,934. I'd like to believe the tests conducted were mostly from people who wanted to travel. But anyway, let's hear it from Dr. Tony Leachon. Magandang araw po sa inyo, Dr. Tony. It's nice to have you with us over coffee chat. Magandang araw po.
Magandang araw, Melo, at sa mga nakikinig at nanonood sa iyong programa. Magandang araw po sa inyong lahat.
Ano po ang inyong nakikita sa pagtaas ng bilang ng mga nagkaroon ng COVID-19 kahapon sa report ng DOH, 17,231? What are your thoughts about this?
Well, yung pagtaas kasi ng bilang, function yan ng maraming bagay. Pero pagka meron ka ganitong klaseng surge na napakataas, which is the all-time new record high, yan ay ibig sabihin may mobility. Ibig sabihin lumalabas ang tao. Kasi ang fundamental principle ng epidemic is to slow down the virus. Kaya nga ang pinaka-effective na preventive measure is social distancing. So, mafe-feel natin yan last year with the imposition of the ECQ on March 15, 2020, napansin natin na wala halos cases at nung nagbukas ang ekonomiya ng July, August, sumipa yan ng 6,000. Tapos MECQ, pagkatapos doon, matagal na may quiescent period tayo. Tapos nakapasok yung variants natin ng United Kingdom, South Africa at saka itong Brazil. So after 1 week lang ng March 1 vaccination sa UPPGH, doon na tayo nagkaroon ng surge at ang highest noon ay 15,000. So nung nag-15,000 tayo noon, ang ginawa ng government, nag-ECQ sila, series of MECQs, bumaba tayo from 15,000 to 4,000. But we reopen right away. Nakapasok yung Delta variant. Nung nakapasok ang Delta variant, here we are. Di tayo nakapagsara ng ating borders kagad sa Indonesia, Thailand, and Malaysia. So here we are right now. Kumalat na yung Delta variant, particularly sa NCR, Region 4A at saka Region 3 and other parts of the Philippines. So yung kahapon is actually a confluence of all the events, and basically yung preemptive ECQ natin, I think that is not the real ECQ na dapat ginagawa natin in a hammer dance concept. And then yung makikita mo yung positivity rate ay 26%, which is the highest. Ang ibig sabihin niyan, di tayo nagte-testing mabuti, which is a fundamental and the most effective pillar dun sa mga ating tinatawag na mitigation measures. Kasama dito ang contact tracing, isolation, and quarantine. Pero ang pinakasimple ay positivity rate at testing ang sagot dyan. Pag titingnan mo naman yung number of cases outside, yung 17,000, nangangahulugan yan, marami ang nasa labas. At kaya maraming namamatay. Ang death natin kahapon ay nakakalunos, or 315. At
317? Gano'ng kalaki.
Ganun kalaki. At puno yung hospital, kung mapapansin mo, Melo. Ang hospital natin ay 72 to 73%. High risk yan pagkaganyan. So, ang problema niyan ay nakikita ko, pag hindi binago agad ng Malacanang ang decision nila on the MECQ, magbabalon pa tong 17,000. Since ang reproduction number natin ay 1.8, ibig sabihin, dalawa. No? Pero Delta variant strain ito, ang reproduction number nun 8. kung siguro Chinese Wuhan strain, isang tao, 2 ma-infection. Pero ito, ang Delta variant, 5 hanggang 8 ang pwede ataka within seconds ito. So, ang nakikita ko, pag hindi binagong strategy right away, baka we will reach 20,000 next week. And then by the end of the month, baka abutin tayo ng 30,000. At the rate we're going, kasi one day lang, tumalon tayo from 14 to 17. At sa last 10 days, naka 100 million tayo. Grabe yun. The last 10 days, kinikwenta ko, ang dagdag natin ay 100 million. So hindi siya biro-biro.
100,000?
100,000, yeah.
100,000. Okay. So, sa ganitong pagkakataon, ano yung dapat gawin? Dahil yung New Zealand, nagkaroon ng isang COVID-19 positive, tapos they opted to lockdown. Nagkaroon na sila ng 10, tuloy pa rin yung lockdown. Ganon din ang Vietnam. How different is our approach from the other countries?
Our approach is basically lack of a roadmap and the lack of medical opinion leaders. Kasi when you have a team na hindi balanse, kasi pansin mo dito sa 17,000 na to, when they decided on the MECQ or the 14,000, walang input coming from the Department of Health. Dapat merong ganito Department of Health supports the MECQ, and the rationale for this is 1, 2, 3, 4. Ang mamarinig mo lang si Secretary Roque. Parang hindi na effective yung ECQ, mag-MECQ na kaya tayo. Parang counterintuitive. Ang taas ng cases sa pa nag-MECQ. Para wala na nag-iisip, ibig sabihin ganun kataas ang level ng discussion. Tapos nung in-interview sa radyo, ang sabi, kasi parang hindi na ho effective ang ECQ kaya MECQ na kami. Aba, naiintindihan kaya ng mamang ito ang pinagsasasabi niya na pagka lumawag ka, ang fundamental principle ng epidemic dapat walang mobility. Tapos tapos ang galaw mo, wala pa rin walang dining, walang outdoor. Bakit ka pa nag-MECQ? So ibig sabihin, kaya sila gulo, they're affected by external forces, mga business leaders, which I think wala namang masama doon. Kaya lang, when the NEDA, the DTI, and the DOF being pressured by the business community to prevent a lockdown, ang nangyayari, lalo ka napapa-lockdown. Kasi siyempre, lockdown ka, mataas ang cases mo, mabuti sana kung nag-dip o bumaba ang cases mo. Reopen mo yung economy. So, kaya ang laki ng tama sa kanila today Kasi they decided MECQ on a 14,000. Tapos the next day, 17,000. Kumbaga, if you're in the palace and you're the president, tama ba itong ginawa namin na 14,000 nung nag-decide kami, 17,000, tapos ang positivity rate mo 26%. Kumbaga, wala man lang nagsalita sa Department of Health the next day na 17,000 to explain the MECQ decision. Bakit gano'n na naging decision? Parang counterintuitive di ba? The higher the cases tayo, all-time high din sa positivity rate. Wala kang input coming from the medical leadership. Ang head pa naman ng IATF ay the Department of Health Secretary. Kaya lang, ang nakita ko diyan, kaya sila na nag-decide because the Secretary was busy defending himself in the Congress and the Senate. And with the what you call this admission of the Secretary na siya gulong-gulo ng isip. So paano ka magde-decide right now kung gulong-gulo ang isip mo, di ba? So ang nangyari nito, during the time na nag-IATF meeting, in the middle of a Senate hearing and a Congress hearing, walang input ang medical. Walang input ang medical. Kaya ang nangyari dito, nag-secret balloting sila. Kasi they didn't want them to be accountable for their decision. Hindi katulad, let's say sa Congress and Senate, when you vote, let's say, for this particular
bill
decision.
or measure, you have to defend your stand.
Oo, di-defend mo. Sasabihin mo, long speech yan I vote no. Ayan, okay.
Or I vote yes.
I vote yes or nay. Ganyan. O. Ito, since major decision to from ECQ, tapos ang taas ng cases, I expect the cabinet secretaries, member of the IATF, mga 30 sila, pag nga may important decision, the president would call pa nga for the medical opinion leaders eh. Diba? Naka-televise yan.
Mm-hmm.
Naka-televise yan. Kasi major important decision eh. Suddenly, wala nun. Diba? Hello? Suddenly, wala yun. At ang nakita natin secret balloting na inamin pa na yung presidential spokesperson. So sabi ko, ano ba to? Chris Kringle lang ba to? At dinidecide na tayong secret ballot. So walang kumukuha na accountability. So the next day, nung kailangan mag-interview, presidential spokesperson na sumasagot. Pero ang hinahanap ng tao, ano medical reason? Kasi kahit ka kunyari lumabas, walang lalabas yan. Kasi ang tao for the last 17 months, marunong na mag-interpret ng data. Marunong na mag-interpret ng data. At every day, marunong na sila. Tinitingnan na yung cases. Tinitingnan na positivity rate. Tinitingnan nila yung number of deaths. Tinitingnan nila yung hospitals kung punong o hindi. So I was looking for the medical input. So ngayon, I posted in my Twitter right now, you have a perfect storm here. Eh. Ang perfect storm mo, you have an all-time high, number 1, na record. Number 2, you're in the middle of a COA report na loss of trust, particularly the 67 deficiency funds. Number 3, you made a wrong decision on the MECQ. Tapos number 4, you're slowly eroding the credibility of the palace dito sa decision na to. And then, number 5, this will spell more problems both in health and economy. Kasi ang decision mo MECQ, lalo maraming cases, maraming hospital. So eventually, mapo-force talaga ang government to a total lockdown uli. I bet you in the next 1 week, kung yan ay umabot ng 25,000 to 30,000, mapipilitan silang magbalik agad sa ECQ and implement the right ECQ. Ako naman, the moment na mali ang decision mo, kahit 1 day pa lang, I wouldn't mind na magpalit ka agad to ECQ. Oo, sabi. Oo, sa akin na. Kasi walang sasabihin ng Department of Health kung PR ang pag-uusapan. Teka muna, hindi nakapag-input diyan ang Secretary of Health kasi busy sila sa Congress and etong decision nila. Balik natin uli sa ECQ. Rather than put the president on the spot kung bakit sila nagkaroon ng MECQ. Though I really don't believe already in lockdown kasi in America wala nang lockdown. Ang ginagawa lang nila doon, free testings at saka increased vaccination. At every corner, meron kang mobile van or meron kang mga stores na magpapatesting ka libre within so many hours lang. And then ang bakuna mo, you can enter Walgreens, CVS, Walmart, walk-in ka lang regardless of your immigrant status or whatever status you have. Ganun lang ang kanilang strategy. Wala silang lockdown kasi marami silang testing. Kung marami kang testing, positive ka, bahay ka. Pag negative ka, trabaho ka and mask ka lang. Tapos bakuna lang ng bakuna. Yan ang strategy. Hindi lockdown. Kasi ang lockdown, hindi sagot yan eh. Papatayin mo talaga economy dyan. Papatayin mo lahat ng tao dyan eh. Ang strategy, testing. Which I don't think nakikinig ang government, even the vaccine SAR or the testing SAR. Kasi ang dami naman medical advisors dyan, bakit hindi na-i-increase ng testing? Yun ang fundamental principle. Or else, lockdown tayo ng lockdown. Hindi na tayo makakaalis dito.
Nung lumalahok pa ako sa Malacanang press briefing ni Secretary Roque at nagiging guest si Secretary Vince Dizon, tanong ko gaano kalawak yung inyong testing? At bakit mababa yung bilang ng inyong natetest? Kaya pag nagkaroon ng positive cases, this may not be representative of what's going on sa ground. Di po ba, Doc?
Tama yung analysis mo. Kasi kami, katulad ako, doktor ako. Pagkatapos kong mag-history, tatanungin ko yung pasyente, Oh, okay, masakit ang dibdib mo. O mag-ECG ka, higa ka diyan. Oh, di malalaman ko kagad ang diagnosis kung may sakit siya sa puso, di ba?
Aha.
Kung may diabetes ka, may diabetes ako, doktor eh. Ihi ako ng ihi, namamayat ako, mahina ang pakiramdam ko. Oh, magpa-sugar ka. Alam mo kung paano mo gagamutin.
Mhm.
O
Okay.
ngayon, kung wala kang diagnostic test, paano mo malalaman kung maraming cases o hindi? So, ang ibig sabihin, ang dami naglalakad dyan na asymptomatic. Kaya hawahan ng hawahan yan because you don't have testing. And ngayon, dahil ang mahal ng testing sa Pilipinas at lip service lang ang libre yan sa PhilHealth, hindi totoo yan. Yan ay gagamitin mo lang kung ma-admit ka, i-charge mo sa admission mo. Pero yung pupunta ka, mga anak ko, mga doktor kami gumagastos dito sa testing. Anak kong public official, galing lang na Mindoro, 2 weeks doon. Magpapa rapid antigen RT-PCR. Sabi ko, may unvaccinated dito tayong member of the family. Kailangan safe ka anak dito so that makahalubilo ka. Kung hindi, ang mangyayari, we will be forced right now to wear mask to protect ourselves. Ganun na nangyayari ngayon. No? So dapat magpa-testing ka.
Matagal ko na sinasabi yung testing eh. Kaya lang parang ang lagi sinasabi, you cannot expect na yung pamahalaan will shoulder testing for everyone. Yun ang laging rason.
Mali. Kasi ganito yan eh. I-explain ko sa iyo, Melo. Inaral ko
Sige
na
nga
to
po.
Kasi ang sabi ni Secretary Carl Kendrick Chua, 150 billion ang losses mo kada week. Kinuwenta ko kung kada week at magte-testing ka at libre. Based on the population, 10 billion lang. Na-compute na yan eh. So kung 10 billion yan, weekly loss versus 150 billion loss sa lockdown, anong pipiliin mo? Kaya sa Amerika, they put their money on 2 things lang, testing and vaccination. Kaya nga, maganda itong inaaral sa Senado para pag nag-request uli ng budget for 2022, ang lalagyan nila ng budget ay testings, contact tracings, at bakuna lang. Huwag na silang umorder ng mga mask dyan at face shield na yan. Kasi ang bawat tao sa affordability, kaya na nating bumili yan. Sa totoo lang. Pero yung testing, sino naman ang kaya yan? Kung minimal wage earner ka, 4,000. Walang gagawa niyan. Yun ang lagyan nila.
4,500 nga pag yung sa bahay ka pakukunan.
Exactly. So ngayon, kung sagot ng gobyerno yan, may supplier ka at kukunin yan in bulto, i-slash mo ng 50% ang RT-PCR, 'di ba? Tapos i-implement mo yung price cap na hindi and then order ka rin ng another diagnostic tool, yung rapid antigen. O di ang dami mong ngayon tools para ma-diagnose. Yun ang gagawin mo. Kaya itong sana, kung nakikinig ang Senate ngayon, you put your money where your mouth is. Ang strategy, test, tracing, bakuna. Pero tinan mo, ang nagasusan, kung nakikita mo, hindi nagasusan yung dapat gasusan, yung mga healthcare workers, hindi. Ang daming in-order ng funds, ng mask at saka face shield. Kaya na naman nating sagutin yan eh. Yung mga 20 pesos na yan, kaya. Pero hindi natin kaya kung every 2 weeks, 4,000 ang gagasusin mo niyan. Talagang susuko ka talaga yan. Yan ang dapat sinasagot ng government. Okay. Para wala kang ayuda. So babaguhin mo ng plano, ladies and gentlemen, there will be no more lockdowns. Na-announce mo na yan. Okay. Di ganyan. So we will follow the best models in the world na walang lockdown. They only use lockdown to be acute surge ka. Di yan ang kulatilla. But we will ask for budget right now for testings, contact tracings ng tao. Kung wala, we will ask Seoul, Korea, and Singapore, whatever app that they're using there effectively, we will try to get it here and we will pay with the DICT and the Department of Health working on it. And then may train the trainer, yung Singaporean na yan, di ba? May Israel nga, kinukuha. Ngayon, yung technology ng Singapore at Korea, turuan muna tayo, i-install yan kung saan-saan yan. Pag meron na tayong contact tracing, hindi masosolve na. And then ang susunod, rationalization of the vaccines. Why should we order vaccines that are not effective for the Delta variant? We're crazy. We're
Okay.
crazy. Umorder tayo ng bakuna na hindi effective for the Delta variant. Eh pag sumipa ang Delta variant, kaya mga tao ngayon, they asking right now, Melo, for booster. Because
Yeah.
they're reading. Because they're reading. Tapos, no, sasabihin nila, hindi pa daw approve. Eh sa Amerika, ma-approve na. They will start September 20. Nagkakamali na naman sila because they are not reading abroad. Kung ano nangyayari. They will try
Okay.
to defend. Oh.
Okay. I came across a statement from another friend, Finance Secretary Dominguez. Ang pagkakasabi niya, yung final tranche ng 50 billion yen loan natin, na-release na. Yung palang tranches nito, na-release sa kada deklarasyon ng pamahalaan kung magkakaroon tayo ng MECQ. Yung kasing unang release, nung January 5, 2021, after the executive issued presidential proclamation noong November 18, 2020, which declared a state of calamity for Luzon. Pero before that, yung first tranche, 10 billion yen, nirelease noong October 27 after the president declared a state of calamity across the country noong September 12, hanggang September 12, 2021. At iba pa. Yung final tranche, 10 billion yen, dahilan sa resolution ng IATF which placed NCR under ECQ from August 6 to 20. So, maraming pera pala ito at ang purpose ng perang ibinigay o pinahiram ng Japan para tugunan yung pangangailangan ng pinaka-vulnerable sectors of society. How do you feel about that? We get foreign loans just like that.
Well, yun na nga di ba, naalala mo, hindi natin nalaman na ang dami pa lang pera natin with the COA report na unobligated every time ako nga, we fought together in the syntax advocacy to increase the budget for PhilHealth and the Department of Health way back in 2012, if you remember, with Secretary Ona, and you were there helping us. And then nung naging increase ng budget, I remember the time 50 billion lang ang budget ng Department of Health. Ngayon 221. So ibig sabihin, nung nagulat lang lahat, nung may 67 billion at 11 billion unobligated, aba, Diyos ko, hindi ginagamit. So what's the use of getting all of these funds when the Department of Health is not using it? Unused and misuse. Sayang. Okay. So, I mean, okay lang naman yan yung sinasabi ni Secretary Sani Dominguez. You get all the loans that we need. But if the budget na kinukuha natin through the legislative mill, hindi natin ginagamit to our detriment, then we have a problem here in terms of management and leadership.
Yeah. Okay. Sunod-sunod ang dating ng bakuna. Do you think these vaccines will alter the figures that we have today?
It is a combination of three things. The bakuna will establish the herd immunity. And the herd immunity will reopen the economy and bring back our lives to normalcy. But you must remember that the management of the pandemic, merong acute management, meron kang chronic. So this is for the long haul. Because you can only achieve the full immunity 2 weeks after the last dose. Ngayon, we are on a search right now. Ang kailangan mo rito hammer and dance muna na 2 weeks to 1 month based on the concept by Thomas Pueyo. Pabababain mo muna to by allowing people muna, by not allowing people to go out. And then, testing ka, free testing, then contact tracing. Yan yung acute management. Yung ika-fourth, which is the vaccination kasabay. Ngayon, kung napababa mo ng case from 17,000, let's say to kalahati mo lang, 8,000, then you can actually transition to a lower quarantine with the basic template that the healthcare capacities, testing, tracing, isolate, quarantine, nandun, and then continue ang bakuna. Like ginagawa ng other country to achieve at least the people protection na 50%, the 70% na herd immunity. But with the Delta variant, according to the US, they might need 85 to 90% herd immunity. So the bakuna that we are ordering, okay lang yan. Pero it will not stop the hemorrhage and the bleeding in the next 2 weeks. Ang impact niyan in the next 3 months, granting that the volume of supplies that we ordered will come on time given the tight supply chain globally because of the demand of the United States and the other countries for these vaccines in the midst of a Delta variant scare. Yan ang problema natin. Kasi even if we ordered, I don't think right now magi-stabilize yung supply because the US and other countries are also in the midst of fighting the Delta variant. Ang bakunang effective dyan are the 3 American brands, Pfizer, Moderna, Johnson & Johnson, and the United Kingdom brand that is AstraZeneca. So ang problema natin, 50% of our inventory ay Chinese vaccines. Particularly Sinovac, na walang published article for the Delta variant. Kaya lang, dapat pa rin tayo bumabakuna regardless of the vaccine kasi ang alam ko, meron pa rin tayong Chinese Wuhan strain. So, we will decrease hospitalization, we will reduce the number of critical conditions, but we need to look forward na kung dumating yung panahon like sa India and Indonesia, sa Indonesia gumamit sila ng Sinovac and yet ganun pa rin ang nangyari sa kanila. So they changed right now their strategy. Alam mo ba ang India ngayon from 400,000 last April, ngayon 25,000 na lang sila because of their vaccination. They're averaging 9 million doses a day and with the use of their co-vaccine or Bharat, which is also effective for the Delta variant. Ang Indonesia, I just looked this morning, ang cases nila down from 50,000 a month ago. Ngayon ay nasa ano na sila, 22,000 cases. So they're actually right now over the hill. Ika nga, papagano na sila, nandito na sila sa baba. So anong ginawa lang nila? Nag-lockdown sila. Sabi ko nga sa iyo, importante yan kung epicenter ka. Pero continue with your testing, contact tracing. And then they changed their vaccination program. So they ordered right away, President Widodo ordered Astra and Moderna right away. Yan ang ginawa nila. Ganon sila kabilis mag-isip eh. Ang India naman, ganon din, nag-lockdown sila. When the Prime Minister Narendra Modi na-realize to, ginawa niya ganon din. And then instead na ipamigay na yung kanyang co-vaccine, the Bharat vaccine for countries kasi sila number 1 producer of generic vaccines eh.
Yeah.
Ginamit nila sa kanilang bansa. Oh, look, nasan sila ngayon? They're successful. So, the Philippines should look at these models. Kasi these are third world countries or middle income countries eh. Na pareho lang tayo ng characteristics eh. Now, dapat ganun ang ginagawa natin.
Okay. Yung Vietnam, for a while na-control nila pero hindi yata nasabayan ng pagbabakuna. Kaya nung magkaroon ng Delta variant, tumaas din yung kanilang bilang ng mga may tama, di po ba?
Yes, kaya nga sinasabi ko, the Delta variant changed the landscape of the management ng sa buong mundo, even those successful countries. Pero tinan mo naman, kahit mataas yun sa Vietnam, number 5 lang naman sila sa Asia. At tinan mo yung number of deaths nila kumpara naman sa atin. So relatively speaking, decent pa rin yung performance ng Vietnam because of their healthcare capacity. Matindi ang kanilang testing, tracing, isolation, quarantine. Nagulat lang sila na biglang tumaas. Ang China nga, tahimik na rin eh. Di ba? Tamo Australia din ngayon, na lockdown din. So what I'm saying right now, talaga nagbabago ang management ng epidemic hanggat ang virus ay nandyan. And because the virus dictates right now the destiny of a nation. Ngayon na nangyayari dyan eh. Israel, suddenly, bakunado na sila. They ditch already their mask. And then, nagkaroon sila ng 300 cases. Inaral nila sino itong mga affected nito, young ones. Oh, we need a booster dose kasi palang apektado ay yung mga hindi nababakunahan at saka elderly. So they started vaccinating last week for their booster dose, elderly 60. And then 40 to 60 na susunod nila. So ganoon na nangyayari sa kanila. So they're trying to change their plan of action depending on the present situation of the country. So dapat ganoon din tayo, di ba? Parang bangkayan eh. When the direction of the wind you cannot control, what are you going to do? So you redirect your sails. You direct your sail, di ba? Ganyan ang sinasabi.
Yun ang prinsipyo niyan eh. Tama
yan. Di ba? Kasi the direction of the wind, ang lakas eh. Alangan naman sabanain mo yan. Ang gagawin mo, punta ka, ikot ka rito. Kasi may perfect storm eh.
Meron.
Ikot ka dito, and then saka mo siya harapin. So dapat ganun ang ginagawa ng Pilipinas ngayon. Kasi hindi na uubra yung lockdown natin. Maghihirap. Ang only way is actually to have a lockdown uli, one time, big time, and then allocate money for testing. And then you will never see the lockdown again.
Siguro when I get the chance to join the Malacanang press briefing, I will be asking if and when I could join them. No? I would ask them, how much have you allocated for the testing? Because we've allocated so much for the vaccines. Now, the vaccines will only be effective if we know the figures on the ground, right?
Right.
May problema ka na nga sa contact tracing eh. Di sa testing ka na lang. Tingnan natin kung uubra. I don't know how they'll do it, but we're hoping they would see the light at the end of the tunnel and they don't lengthen the tunnel so we will not suffer. Di po ba? Pero ito yung sitwasyon natin. I can understand where you're coming from, no? Meron din kayong sa inyong pagiging health advocate, nandyan yung inyong drive na let's do something. Pero what about the bureaucracy? How do you look at the bureaucracy?
The bureaucracy kasi, andyan na yan eh. The only way to break the bureaucracy is to appoint agile leaders. Or the same thing na ginawa in my previous experience, a coalition of public and private sector. I remember during the time, we worked for Action for Economic Reforms. And then, ginather namin doon yung mga major stakeholders. Like say, we need an epidemiology. So, we got Dr. Tony Dance. Okay? And then, we got the PCP, Philippine College of Physicians. We got the PMA para there's a huge organization that we can mobilize. We need to know the numbers. So we got the economists from the UP School of Economics. That's Sinamen Santa Ana, na John Latuha, di ba?
Mm-hmm.
So we need the media communicators. So we got the SOCMED people. So we have a complete team. And then we presented our program. Since ako I work with Secretary On as 1 peso concert, ako naging conduit. Secretary, this is the strategy. Ando si Undersecretary Ted Herbosa to support kung wala si Secretary Ona. That's a good move. Okay. So whenever magkakaroon ng press conference, okay, I support you, whatever you will write. O di nakalagay ang headline, Secretary Ona declared ganito. Text ko lang siya, Secretary, tomorrow, there will be a communication. And ito yung announcement natin. We interviewed already Kim Hinares and Senator Drilon and Purisima on this. Okay, go! Ganon kabilis. Ganon kabilis ang strategy na po-formulate mo. So, you unburden ngayon the IATF of thinking too much eh. Ngayon, ang maganda pa with the private sector stakeholders, alam niya ang pulse of the private sector. Sila rin ang conduit. Okay, this is the game plan. Okay, malulugi muna tayo ng konti. Parang Confucius naman yan eh. One step backward,
two steps
forward. Ganyan ang strategy. And then we will never look back again. Yun ang strategy.
Parang ang nakita yata dito, sabi nung ilan, I don't know if it is true, pinatotohanan yung kasabihan na for every crisis comes an opportunity. Ngayon, kung ano yung opportunity yun, hindi ko alam. I wouldn't ask you because you may not know it as well, right?
Yeah, but ang opportunity dapat alam mo na rin darating yan kung paano. Kasi may projections ka on what to see.
Mhm.
Oh.
Okay. Now, if we are to look forward, what should we do as a country and as a people?
Well, sadly, no, I'm sorry, no, but I think we need to change leadership at the Department of Health. These are my reasons. Dati, pag tinatanong ako dyan, by the way, I don't have any desire for any, I'm not running for public office. I'm not out for any position. I'm
You're not running
comfortable.
for the Senate nor
I'm not
Congress.
running for the Senate or the Congress.
Mm.
I'm not running for any position na sinasabi nila. I'm happy where I am, and my track record as an advocate 1 decade na. So yun lang ho yun. So strategy na nakikita ko with so many requests for the Secretary of Health to step down. Sa Senate, 2. And then nung PhilHealth scandal, 2, yung ghost dialysis and the IRM. And then ito na naman, itong COA. This is the biggest because a co-government agency ay nagsasabi sa'yo, hoy, may nakita sa'yo. Ibang usapan kasi yung legislative eh. Maaaring sabihin mo political pa yun, Melo eh. Pero pagka within the government, a body, a constitutional body telling you that there are some deficiencies in your public funds, ibang usapan yan, Melo. So, ang tingin ko, dati, ang sabi natin, let us not change horses in midstream. Oo, ngayon, I think we have to change the horse because the rate of the pack depends upon the rate of the leadership. Kung sino nakasakay sa kabayo, yan din ang bilis ng takbo ng mga stakeholders eh. Kahit ang natitira pa dyan ay 9 months eh. 9 months, you have a lot of things pa na magagawa. And there are many able undersecretaries na nakikita ko, si Yusek Bombega, si Yusek Kabutahe. I think a fresh mandate will restore the credibility sa Department of Health. And of course, bright ideas, nandiyan na siya. Yun ang unang gagawin. When you change the leadership, then they will change, of course, the plan according to this particular leader. Number 3, they have to evaluate the IATF strategy. Kasi iba na yung when they crafted the blueprint for the COVID response, that was anchored on the Chinese Wuhan strain. But you have a different enemy right now, which is the Delta variant. And a Lambda variant na nandyan na. So, in the US, nagbago din ang plano nila. Dati, ang sabi nila, okay na kami. Hindi na kami magmamas. Okay, magmamas ulit sila. Sabi nila, hindi nila kailangan ng booster dose. Mag-booster dose sila. Sabi nila, hindi nila pipilitin ng bakuna, voluntary. Yun. In other countries, persahan na. Sa France, si Emmanuel Macron. Pag sinabi, wala nang baitan dito. Sa atin, voluntary. Wala. Job or jobless. Talagang ganun. I mean, France yun, ha? François. Ibig sabihin, that's France. You have to...
May liberty, kumbaga, no?
At saka yan ay lumalaban. If you review your world history, that is the country na lumalaban talaga sa demokrasya. Kung makikita mo ang history niyan, paborito ko ang world European history. At laging nandyan, in the forefront of the battles for democracy, nandyan ang France at saka nandyan ang... ngayon, pag sinabi ngayon ng Prime Minister mo, supported by the Congress, inaproban yan, ha? Kasi nakita nila, kung hindi kayo magbabakuna, paano makakabalik ang buhay natin? Sapilitan tayo. Ang sinasabi ng iba, you have the right, let's say, we have the right also for vaccination because it's the common good. You have the freedom of expression. But if the freedom of expression mislead and hurt people, that particular freedom, nawawala yan. Ibang usapan yan. Yan ang sinasabi ni Emmanuel Macron. Binabasa ko nawawala yung common good. Kung merong isang malaking pwersa trying to sabotage the national program. dito talaga ilalagay mo ang put down mo. Hindi naman to ang freedom mo stops when the common good is affected. Ganun yan
Aha.
eh.
Okay. So, yun ang sitwasyon natin. You change the horse, ganon? Or you change the
You change
rider?
you change the horse kasi ang head ng IATF, Department of Health Chief. Ang head ng department, siya rin. Ang chairman of the board na natin, DOH Chief. Tatlo yun ha. And also, the ceremonial head of the FDA is Department of Health Chief. Under pa rin niya FDA. So, ibig sabihin, vaccine choices, ikaw rin niya magdi-decide. Imagine mo itong classical, no? Imagine mo in-injectan mo ang presidente na Sinopharm. At that time, wala kang EUA approval. Di ba is an incumbent upon you to know whether this has FDA approval? Di dapat sana na-call ang attention ni Eric Domingo. Nalaman lang nila after one day, hindi pala tayo registered. Nahiya tuloy, pinull out nila yung Sinopharm. Kung the Secretary of Health does not understand vaccine at ang regulatory guidelines, how can you lead this institution? Kaya, by failure of managing the IATF properly, by mismanaging the DOH, by also mismanaging the process as well as the funds of the PhilHealth, the FDA fiasco. Ano pa ba naman ang kailangan mong gawin? You have to change kahit maiksi na yung panahon at baka may magawa pa tayo. And then number 2, change the plan. Change the plan. And number 3, execution. Galingan na natin this time. Tatlo yan execution. May maganda kang plano. Hindi mo naman na-execute properly. Wala rin yan.
Okay. All right. Yung clamor ng mga health workers, yun nasa front line for the benefits, what have you heard?
Well, anak ko, 2 doktor eh. Tapos I work in the hospital. Tapos dati tayong past president ng isang malaking organization, PCP. Wala eh. Nakita mo naman yung mga hinaing ng mga doktor eh. Kasi ever since lumalaban tayo sa advokasiyang to, the #1 exporter of doctors and nurses abroad ay Pilipinas. Lagi ko naririnig to sa speech ni Secretary Cabral eh. Kaya umaalis sa mga doktor at nurses to seek greener pasture. Mainly because of 3 things. Number 1, they are overburdened, they are overworked, but they are underpaid. Diba? So why and then merong greener pasture offering salary na 5 to 10 times higher than the salary here. Magdadalawang isip pa talaga. Kaya in the midst of crisis, gusto pa nila nilang umalis despite na may danger sa buhay nila. Why? Because they have families to feed na hindi natin matutugunan dito. Given the same level of risk or even riskier dito sa atin. Kasi pagpunta nila doon sa bansang pupuntahan nila, ibabakunahan kagad sila eh. Bibigyan sila kagad ng bakuna to protect them with the best vaccines eh. Bibigyan sila ng hazard pay kagad, bibigyan ng pay kagad, bibigyan ng lodging kagad sila. Talagang buhay hari sila. Mantalang dito, the frontliners are being dubbed as the heroes, the Filipino heroes, and yet shabby treatment ang nakikita mo sa kanila. Hindi maganda, hindi magandang tingnan yun. And all of these are basically lip service.
Okay. All right. Anong ipapayo po ninyo sa ating mga manonood? Marami tayong mga nanonood mula sa Saudi Arabia, sa probinsya, dito sa Metro Manila. Ano po ang inyong maipapayo para makaiwas sa pangamba at panganib dulot ng Delta variant at iba pa?
Well, ang una dyan is to address natin ang ignorance. Sa akin is education is the key. Kasi once you know the number of cases, the number of deaths, the positivity rate, kung gaano ka-positive ang tayo, number of tests, kung puno yung hospital, mag-iingat kang lumabas. Sabihin ko sa inyo kung bakit. Ako 2 weeks na ako hindi pumapasok. Nagte-telemedicine ako. Bakit? Kasi I have one unvaccinated member of the family here. I have an apo na 3-month-old. Kung lumabas ako, kahit vaccinated ako, I can still contract the virus pero maaaring mild or asymptomatic ako. So I might hurt them. So by knowing the numbers, yun ang pumipigil sa akin kasi I work in the hospital. So ganun din dapat ang thinking process ninyo. When you see the numbers na ganyan, kaya ang payo ko voluntary ECQ. Yan, doon sa education part. Okay, number 2. Knowledge exists but we fail to apply it correctly. Ang tawag doon pasaway. May ayaw magmask. Katulad ni Donald Trump, ang classical example, ayaw magmask. Ayaw lahat. Social distancing. Ano nangyari? Nagkasakit siya. And lost the presidency because of that cavalier attitude. So yun ang second. And third one is you have to have a game plan. If the government has no solid blueprint right now, baka iniisip pa nila because of this, dapat meron kang game plan. Anong game plan nyo? I'll tell you. Bili kayo ng maraming supply nito kasi ito yung kailangan ninyo. Okay? Kung ariin nyo na to na lagay nyo na sa budget nyo kasi you have to protect yourself. Number 1 yun. Number 2, pag may symptoms kagad kayo, kailangan isolate kagad and testing so that the members of the family hindi magkakasakit. Pinapaliit ko yung problema hoping na pag family ang approach mo, which is the smallest unit of the society, then every family will embrace it. Then you save the whole community. Okay. Then, marunong na kayo dapat mag-isolate. Tapos, marunong na rin kayo mag-contact tracing. Teka, sino bang nakasalamuha ko? Oy, si ate, si kuya, si manong, ganyan. Ganun dapat yun. Pagkatapos doon, magpabakuna kayo. The only essential travel ninyo is that meron kayo schedule for bakuna. Huwag yung sayangin yun kasi habang hindi kayo nagpapabakuna, it takes a while to develop the immunity. So, lahat yan, 2 doses. Alright? Ang isa lang ang single doses, Janssen. Now, lahat yan 28 days except for Astra na 12 weeks. So, ang full immunization is 2 weeks after the second dose. So, kung hindi ka magpapabakuna ngayon, matagal pang effect niyan, mga 2 buwan. So, hindi ka maproprotektahan. Tama ba? So, yan ang dapat dating gawin on an individual basis. Right? Ngayon, kung kailangan nyo magtrabaho dahil hindi ko kayo mabe-blame, ako kasi I can work at home. At tawag niyang work from home. Kung kayo ay magtatrabaho at essential worker kayo at kailangan talaga kayong sumipot doon, be sure bakunado kayo. Kasi iba yung bakunado pag lumabas ka. Yun ang aking payo. Magpabakuna kayo. And, of course, maglaan kayo ng budget kahit sa rapid antigen kasi mas mura yun. Mas mura yun. At saka meron yung YouTube. Ngayon, kung ang kumpanya nyo mabait, maraming kumpanya mabait na sino-shoulder every 2 weeks ang testing, swerte nyo. And that will keep the economy afloat when the private sector understands the problem and the families and the individual members of the society naiintindihan yan. So regardless of the leaders, regardless of the national leaders, regardless of a national plan, you have to have a family plan of action so that you will not contract the virus. Ganun ang aking strategy.
Okay. Maganda yun. Well, this won't be the last interview we will have, Dr. Tony. We will call on you depending on your free time. We can understand. Yung inyong program kagabi, pinutakti kayo ng mga tanong ng mga tao, nakakatuwa, bagamat nakakalungkot din, very tiring to attend to all this feedback from people, pero it gives us hope. And hope springs eternal. Thank you, Dr. Tony. You stay fit and keep us posted. Till next time, maraming salamat po. Magandang araw and happy weekend.
Thank you, Melo.
Salamat po sa ulitin. Thank you.